Okay, so I'm just going to show you around the room really quick. My living room. This is my sister Bailey. Nobody over there. Nothing on the table. There's my laptop. It's closed. Okay. Okay, so before entering the room, I'm going to check the chart. Once I am in the room, I'm going to pull the curtain for privacy. I'm going to then wash my hands and ask the patient for two identifications. Sorry, my phone is slipping. Okay, so once I get two identifications, I'm going to have her state her name and her date of birth.
My name is Bailey Upton, Bailey Lynn Upton, and my date of birth is June 15th, 2005.
Okay, perfect. I'm going to now just introduce myself. So my name is Alicia and I'll be your nurse today. On a scale of 0 to 10, can you tell me what your pain is?
7.
Okay, perfect. So now we are just going to go through the assessment and I'm going to ask you a variety of questions. Just answer the questions to the best of your ability. We are going to start with skin and hair. So I am going to just ask you a couple questions like I said before. So do you have any history of skin cancer?
No.
Any abnormal moles?
Nope.
Any lesions? Okay. And do you have any balding on your hair? Okay, perfect. Now I'm going to just inspect her skin with my pen light. So I'm just going to look around. Her skin color seems to be fine. I see no abnormal findings. I'm just going to run my fingers through her hair. So I'm going to feel for her hair texture. Her texture seems to be fine. Her hair condition is perfectly fine as also. Her hair is evenly distributed. Let's see. I'm going to then palpate her with the back of my hand for temperature. I'm just going to put my hand on her forehead. And this is assessing for temperature again. Okay, good. I am now going to move down to neuro. I'm going to ask you, do you have any history of like memory loss?
Nope.
Okay. Any head injuries?
No.
Okay. So now I'm going to look at her appearance, which includes her personal hygiene, the way that she dressed, her posture, and her body movements. And they all seem to be perfectly fine. I see no abnormal findings. I am going to do behavior now. I'm going to look at her behavior, and she seems to be relaxed. She has the appropriate behavior for the setting. I'm going to now ask her 3 different questions, which is going to be her cognitive thinking. So just answer these questions to the best of your ability. So, who is the president?
Donald Trump.
Okay, and where are you right now?
My sister's house.
Okay, and what is today's date?
October 5th, 2018.
Okay, perfect. Now we are going to just hop down to her logical thinking, and her logical thinking seems to be good. I understand everything, so there's no abnormal findings there. We are going to go down to her head now. So I'm going to ask you a couple more questions. So have you had any head injuries?
No.
Any trauma?
No.
Any lesions in the head?
No.
Okay. So now I'm just going to inspect her head for the size, shape, again, the color. See if there's any lesions visible. Okay. Okay, I see no lesions. She seems to be perfectly fine. I'm going to palpate her temporal artery, which is right here. Her temporal artery seems to be equally bilateral, which is a +2, which is normal. I am now going to do the cranial nerve number 5 test, which is placing my fingers right here on her jawline and having her open and close her mouth. Go ahead. And close. And open. And close. Okay, so cranial nerve number 5 is intact. Now we're going to do cranial nerve number 7. Can you puff your cheeks? Raise your eyebrows? And smile. Perfect. Cranial nerve number 7 is intact. We're going to move down to her neck area now. Have you had any stiffness of the neck?
No.
Okay. How's your ability of moving it?
Great.
Okay, good. So now I'm going to just inspect the neck for her skin color, for any abnormal findings, for like any lesions or discoloration of the skin. I see no abnormal findings, so her skin seems to be perfectly fine. Her neck is good. I'm then going to do cranial nerve number 11 by placing my hands on her shoulders with resistance and having her put up and down. Okay, good. Cranial nerve number 11 is intact. So now I'm going to do just like a rotation from a left to right, which is range of motion. Okay, good. I'm going to have her stick her jaw out, which is called protraction, and retraction, sticking it in. Good. Seem all to be intact. I am now going to go to her eyes. So do you have any drainage in the eyes?
No.
Any blurry vision?
No.
Okay. Any difficult seeing?
No.
Okay. So now I'm just going to inspect her eyes. So I'm going to take my pen light and I'm going to flash the pen light in one eye and look at the other one. And then I'm going to flash the pen light in the same eye and look at that one at the same time. So I'm just going to do that really quick. Look at me. And the other eye. Okay. Everything seems to be fine. Nothing abnormal. So I'm going to now do another eye test with my pen light. I'm going to have her look at something behind me and have her look at the pen light again. So can you do that for me? Look at something behind me. Look at the pen light. And look at behind me. And look at the pen light. Okay, so no abnormal findings there. I'm going to have her pull down her eyelids for me. I'm going to flash the light in your eyes. Okay, no abnormal findings there also. I'm going to have her close her eyes and I'm going to look at her eyebrows and her eyelashes. Alright, that seems to be good. No abnormal findings there. Her hairs on her eyelashes and on her eyebrows seems to be evenly distributed also. I'm now going to do another test, which is testing cranial nerve number 3, 4, and 6, which is just follow my pen light. Again, this is testing for cranial nerve number 3, 4, and 6. Okay, so 3, 4, and 6 are intact, and I see no abnormal findings. So now I'm going to go to, I'm going to actually say that cranial nerve number 2 is the eye test, which is called the Snelling test. We are not able to do that test right now because I do not have an eye chart with me. So, now I'm going to do the ears. So I'm going to ask you, do you have any drainage in the ears?
No.
Okay, good. Do you have any hearing loss?
No.
Do you have any lesions in your ears that you're aware of?
No.
Okay. Do you have any difficult hearing?
No.
Okay. So now I'm just going to take my pen light and I'm going to just inspect her ear. And I'm going to look at the size and the shape of her ears and see if there's any lesions available to see. So her size of her ears seems to be reasonable and her shape are perfectly fine. The ear does line up with the eye, so that's good. I'm going to now put the pen light in your ear just a little bit. I do not see any discharge, so that's good. Just some earwax. Your root canal, your ears seems to be fine. No discharge, no lesions. Other than that, everything seems to be good. I'm now going to do the whisper test on her. So I'm going to go behind her and I'm going to ask her which ear she can hear this in. Okay, perfect. The whisper test was, we were doing the cranial nerve number 8 on her. So now that we're done with that, we are going to move down to the mouth. For the mouth, do you have any, when was the last time you saw a dentist?
2017.
Okay, good. So do you have any root canals?
No.
Any toothaches?
No.
Okay. Do you have any lesions in your mouth that you're aware of?
Nope.
Any cold sores?
Nope.
Okay, good. So now I'm going to just inspect her mouth. And I'll have her open her mouth. I'm going to look at the soft palate, the hard palate, the bronchiole. I'm going to look at her tongue and her teeth and her gums. So just open your mouth for me. Look up. Okay, so move your tongue to the left and right for me. Okay. Can you lift your tongue up? Okay, good. So her hard and soft palate seem to be fine, moist and pink, along with her gums, her tongue. Her teeth are intact. I'm now going to test cranial nerve number 9 on her. So I'm going to have her open her mouth and say ah. Okay, good. Her cranial nerve number 9 seems to be intact. She also has tonsils are a +1. They're not touching, which is good. I'm going to now do cranial nerve number 10 on her, which is having her swallow. So can you swallow for me? Okay, good. I'm now going to do cranial nerve number 12, which is having her say light, tight, dynamite.
Light, tight, dynamite.
Okay, perfect. She did cranial nerve number 12. It's intact. She's perfectly fine. I'm going to have her I'm gonna have her open her mouth one more time, sorry. And stick your tongue out for me. Her tongue seems to be moist and pink again. And can you say ah? Open your mouth big.
Ah.
Okay. Like I said, her teeth are intact. Her wall in the back is moist and pink as well. Everything seems to be fine. No abnormal findings there. I'm going to do the I just realized I forgot something. So doing the head, I forgot to do doing the pre-ocular, post-ocular, the occipital. Then I'm going to move to the middle of her chin, which is the submandibular, the tonsillar. I'm going to do the superficial clavicle. You can move your head this way for me. Her deep cervical, right here. And then posterior cervical is right in here. And then her superficial clavicular is when do that like this. Okay, perfect, is right in there. So that's good. I'm now going to go back to the nose. I was finished with the mouth, so now I'm going to go to the nose area. So when doing the nose, I'm going to do you have any drainage?
No.
Any trauma to the nose?
No.
Okay. So now I'm just going to inspect her nose for any abnormal findings, which are any lesions in the nose, any trauma to the nose. I'm going to look at her size of the nose. Her size seems to be fine. I'm going to have her look up. I'm going to look into her nose. And look in the other one. Okay, so everything seems to be fine there. I saw no abnormal findings. I would then do the smell test on her, which is testing cranial nerve number 1. I do not have anything for her to smell, so let me just grab something really quick. Close your eyes. Okay. Can you smell this for me? Can you tell me what it is?
Mint.
Perfect. It was a piece of gum, mint flavored. Okay, so cranial nerve number 1 is intact. So after doing the nose, I am going to do the musculoskeletal. So I'm going to watch her gait. So I'm going to have her stand up. Go ahead and stand up. Have you walk this way for me. And turn around. And walk back. Okay. So her gait seems to be fine. No abnormal findings with that. I'm going to have you stand here. I'm going to have you close your eyes. This is testing for her okay. I'm going to have her sit back down. Oh, testing for her balance. I'm sorry. So that was testing for her balance, and her balance seems fine. I'm going to now do the range of motion on her. Actually, no, not yet. I'm going to have her grip my 2 fingers. Okay, good. I'm going to have her push against my hand. And I'm going to have you pull against my hand. Whoa! Okay. Now with her feet, I'm going to do the barbaric test, which is on your foot, running it up her heel over to the big toe, and she should flex some. So I saw no abnormal signs there. I'm going to have her push like a gas pedal with her feet. Okay, good. And I'm going to have her pull with her foot. Okay, good. I'm going to have her, you can't see this part, so I'm just going to move this closer. I'm going to have her move her feet up to her shin and bring it down. And with the other leg. Okay, good. And can you raise your legs for me? Okay, good. Now I'm just going to put this back. So I'm going to have her now do the range of motion, which are, so we're going to start with her head. We already did rotation, so we're going to do that one more time. So this way and that way. Pronation is bringing your jaw forward, and bringing it back is retraction. So protraction, sorry. Protraction is bringing it forward, and retraction is bringing it back. I'm not sure if I did cranial nerve number 11, so I'm just going to do that now. So I'm going to have her push up and down. This is testing cranial nerve number 11. Seems to be intact. Now we're going to do abduction, which is bringing your arms out, and adduction is bringing them in. Good. Now we're going to do surduction, is bringing it around with the arm. Okay, good. Pronation, with the palms flat. Supination is like palms up. Now we're going to move down to inversion of the feet. Bringing your feet in, and then exversion is bringing them out. Okay, go ahead and sit down. And depression is a lower of the body, and elevation is a body part above the body or something. Now I'm just going to run through the cranial nerves to make sure that I didn't miss any. So cranial nerve number 1 was the smell test, and we did that with a piece of gum. She did have cranial nerve number 1 was intact. Cranial nerve number 2 was the eye test, which we could not do because we don't have an eye chart. So cranial nerve number 3, 4, and 6 were also the eye test, which was bringing them out, over, and down, and she did perfectly fine on all of those. So cranial nerve number 5 was the jaw, opening and closing it. We did do that one. Cranial nerve number 7 was puff your cheeks, raise your eyebrows, and smile. So that was intact. So cranial nerve number 8 is the hearing test. We did do that one. And cranial nerve number 8 was intact. So cranial nerve number 9 was her saying ah, and that was also intact. Cranial nerve number 10 was her swallowing, and that was also good and intact. Cranial nerve number 11 was the resistance of the shoulders, and that was good. Cranial nerve number 12 was the light type dynamite. And we did all of them, so we are done here.